Yeah, I think we'll start. Wonderful. Hi, all. Thanks for joining us. We're just going to give it a few minutes for folks to jump on the webinar, but really appreciate your interest in this work and spending time with us this afternoon. Wonderful. Well, I think we have a good number of folks who have joined, and I want to be mindful of people's time. So we will go ahead and jump right in. My name is Jason Resendez, and I'm President and CEO of the National Alliance for Caregiving. The National Alliance is one of the leading organizations focused on shifting systems to better address the unmet needs of unpaid family caregivers. We do this through a national coalition model, which includes institutions from across society, including leaders in drug development like Travere, in managed care, in patient advocacy, in financial services, and beyond. And we bring folks together around initiatives in policy and research and programming to build health, wealth, and equity for America's 53 million family caregivers. And one of the most critical components of building better health for family caregivers is addressing their mental health needs and promoting mental health as an integral part of addressing the needs of family caregivers. So excited about the work that we've been undertaking in this space and to share more about it with you today. This work wouldn't be possible without the support from one of our key members, Travere Therapeutics. We're very excited to be joined today by Eve Dreyer, VP of Patient Advocacy at Travere. She has served as a patient advocacy leader for 20 years. She is founder of Rare Disease Diversity Coalition and previously launched Teens for Pink, engaging African-American teenagers in breast cancer education. She spent 15 years as a partner in a healthcare PR agency with clients including AstraZeneca, Eisai, GlaxoSmithKline, and Janssen. We're very excited to benefit from Travere's support, but also, more importantly, from Eve's energy and stewardship and leadership. So with that, I'll turn it over to you, Eve.
Jason, thank you so very, very much. I was just delighted by the opportunity to offer a few comments because not only is the mental and emotional health of caregivers a subject that is near and dear to our hearts at Travere, and one that we are working with various rare disease advocacy groups to address each and every day. But like many of us, I have been a caregiver. And I am a caregiver of a family where we have actually had a double whammy because I helped raised a child who herself suffered from severe depression and a husband who suffered from bipolar disease. And that certainly led to even more complicated emotional drains on the siblings within the family. So I've walked in your shoes. I know what you're doing. And we were so delighted when my colleague, Shika Dunyo, was approached by NAC about a year and a half ago now to work together on this mental health for caregivers initiative. So I couldn't be more committed, both as an individual and as a member of a company that is committed to helping the families of those with rare disease balance the emotional health of their family, to be able to participate today. It's an amazing report that you've done. I'm looking forward to a very robust and probably emotional dialogue today, but I just wanted to thank you for allowing us to participate. And I just wish you all the very best in making sure that you're taking care of your balance of emotional health. So thank you so much.
Wonderful. Thank you, Eve, for that personal reminder about how care is one of those things that connects all of us. It is a common bond that so many of us share, from whether you're working in corporate America or you're an advocate or you're making it day to day. Caregiving is one of these common threads that connect so many of us in communities and nationally. And we want to continue to anchor our work in the lived experiences of family caregivers, which is core to who NAC is as an organization, really focus on translating the lived experience of family caregivers into action through policy research and system change programming. And to help us do that today, building on Eve's personal story, I want to introduce Jeannie Shields, who's a transplant family caregiver for her daughter, Lauren. When Lauren was 8, she received a heart transplant. And when she was 20, she received a kidney transplant, for which Jeannie was a living donor. Lauren is now 23 years old, and Jeannie has a powerful story that I'm excited for her to share with all of you today to help us anchor the rest of the conversation around the real impact that caregiving has from a mental health perspective. So over to you, Jeannie. Thanks for joining us.
Awesome. Thank you so much, Jason. Yeah, you know, if I wind back the clock and think of the journey, I can remember the feeling of fear that I had when Lauren was initially admitted into the hospital. You know, up until that point, my kids were perfectly healthy. We hardly had Tylenol in our house. Lauren wasn't born with a congenital heart defect. She simply caught a virus that attacked her heart. We don't know what the virus was or exactly when she caught it. Viral myocarditis silently attacked her heart until the time she reached the hospital, and her heart was only functioning at 14%. At the time, I was working and managing a real estate office. I had 85 sales agents and a staff that I was overseeing. I was on an amazing career path. The demands of my job were very high, but when Lauren became sick, I went into full mommy mode. I packed a bag and I stayed with her every night of her hospitalization. I went to work each day though. My parents would drive to the hospital and come upstairs to stay with Lauren. I would take their car and go to work. I felt the pull of being both a caretaker and a breadwinner. I worried about losing my job. I worried about bills. I worried about my then middle school age son, Brandon, who was home trying to carry on with school and sports and trying to maintain a somewhat normal life. In the weeks and months to come, Lauren's health continued to decline, and they told us she would need a heart transplant. She felt sick, she was angry, and most of the time she was just scared. I was scared too, but I never let her see it. I decorated her hospital room, wore bright clothing, continued to do arts and crafts projects, and at night when the lights were out, I would just cry in silence. Then one day I went off to work and got the call. They wanted me to come back to the hospital because Lauren needed to be put on full cardiac and life support. Her body was giving up, and in order to make the transplant possible, this needed to be done. She went off to sleep, and we waited for the call to come that she had a donor. From that day forward, I didn't go back to work. I stayed by her bedside. I took all the decorations down since they needed to do multiple procedures on her. She hemorrhaged constantly on the machines. It was horrible to be there and watch. I felt helpless, depressed, and I kept it all in. I didn't want to allow myself to feel that way on the outside. I equated that with defeat. The days were long, but the nights were even longer. The machines alarmed constantly, serving as a reminder of the fragility of it all. The longer we waited, the more I thought about the possibility of losing her. Lauren's transplant came in March of 2009. In all, she spent 9 months in the hospital, most of it in the ICU. During that time, while I had my wonderful family there for support, no one ever spoke to me about mental health services for me as a caretaker. Although, to be honest, at the time, I'm not sure how I would have responded. I was just so focused on her. Upon returning home, it was a whole new regime of physical therapy, medications, navigating weekly follow-ups with doctor visits. Lauren had had a stroke after her transplant and was completely depleted from her hospitalization. She couldn't walk, stand, or even sit in a chair without a back. I needed to carry her everywhere. The adjustment to home life was very difficult for all of us. I started to slowly realize the impact of the journey on my mental and physical health. myself. I had developed insomnia, so I laid awake at night worrying about the future each and every night. I had to resign from my job, so I also had the added worry of finances. Ever so slowly, things improved, but the road has been and will likely always be bumpy for us. As the years have gone by, Lauren's now 23. She's working for the nonprofit Live on New York, which is the organ procurement organization in New York. And while she's considered an adult, I'm still her caretaker. To this day, I still uncover trauma from my own experience. We both do. I never know when or where it'll happen. I want to thank the National Alliance of Caregiving for inviting me here. My hope is that research, advocacy, and legislation continue to improve so that we all feel supported in our caregiving journeys. As I was once reminded, you can't pour water from an empty cup. Thank you.
Wow, thank you so much, Jeannie, for sharing your story, for reminding us about the real impacts that caregiving has and about the amazing dedication that caregivers have. So happy to hear that Lauren is thriving in part, in no small part, due to your tremendous dedication to her care and to being a care partner in her journey. Lauren's story, Jeannie's story, Eve's story reminds us that caregiving is fundamental to life. From the moment we take our first breath, the moment we take our last, caregiving is a common bond. And while these stories certainly are unique, they're also common across America. In fact, there are 53 million unpaid family caregivers in this country. Next slide. One back. There are 53 million unpaid family caregivers in this country, more than there were in 2015. This is an issue that so many of us are navigating. I know for me, my introduction to caregiving was through my mother, who I watched raise 3 kids while working a full-time job and taking care of my grandmother, who battled multiple chronic conditions, a dynamic all too familiar in Latino households. And that care came with consequences. It came with mental health consequences, it came with financial consequences, it came with other healthcare consequences. And we'll explore those consequences today and then zoom in on the state of mental health among family caregivers, and then talk a little bit more about the findings from our mental health initiative and project. Next slide. What we're seeing in terms of caregiving is that not only are there more caregivers are juggling more responsibilities as time goes on. In fact, there are caregivers today caring for more family caregivers than there were in the past. These caregivers are juggling, like my mother, individuals living with multiple chronic conditions. We see individuals caring for more people living with multiple chronic conditions today than we have in the past. Caregivers themselves, over a third, are managing their own chronic conditions 2 or more while balancing care. So care is becoming more difficult to manage. Next slide. And we see that in the data with the rates of difficulty coordinating care increasing over time. Over a third of unpaid family caregivers report that it's difficult to coordinate care on behalf of their loved one. These numbers are even higher for individuals who are coordinating care for someone living with a mental health challenge, or someone living with a progressive brain disease or a serious illness. Next slide. And as a result of these difficulties, this increasing prevalence, is that we see that more caregivers are in high intensity care situations. 40% of family caregivers are what we are considered in high intensity care situations, as measured by the number of hours of care provided on a weekly basis, the number of activities of daily living, the number of medical and nursing tasks that individuals are helping with. So the more hours, the more tasks folks are juggling, the more likely they are to be in a high intensity care situation. And what we see And in our data is that caregivers in high intensity care situations are more likely to experience negative financial impacts, negative levels of emotional stress, and negative healthcare consequences as a result of being in that high intensity care situation. Next slide. So what we're seeing is that caregiving is becoming more prevalent, it's becoming more complex, it's becoming more intense and more inequitable. Across every single one of those data points that I shared, we see deep disparities across communities of color, particularly among women of color. Black and Latino caregivers are experiencing higher rates of emotional strain, higher rates of physical stress and financial stress due to caregiving. Next slide. And when we zoom in on the consequences of care, next slide, we see from a healthcare perspective that about 12 million family caregivers have said that caregiving has made their health worse. We see that caregivers who report that their health is fair or poor has increased over the last couple years. This is, I think, really important because this represents an opportunity for us to invest in caregiver health, including mental health, to promote better care and enable people to make caregiving more sustainable as they're on this essential journey. Next slide. We see from a mental health perspective that nearly 40% of family caregivers report that they experience high emotional stress due to caregiving. Next slide. And when we dig into the data, we see that this is an acute issue for certain segments of caregivers, including older caregivers caring for someone who's 50 or older, for primary caregivers, folks who are their primary care partner for their loved one, and also for folks caring for someone with a long-term physical condition. Emotional distress is higher amongst these caregivers than other caregivers. So there's, again, an opportunity here for us to think about tailored outreach and engagement and the importance of really understanding the mental health impacts of caregiving across specific communities. Next slide. And one of the most important things that we see in our data caregiving in the US is the impact of loneliness as a factor in caregiver mental health. What we see is that among caregivers who feel alone, 72% experience emotional distress compared to just 24% who don't feel alone. So social isolation, which we all know has gotten a lot worse due to the COVID-19 pandemic, has really harsh impacts when it comes to emotional distress and mental health for family caregivers. So it's no wonder that Surgeon General Dr. Vivek Murthy called loneliness a public health crisis. And that's certainly the case for unpaid family caregivers. At the same time, a really critical report that was released earlier this year that outlines our epidemic of loneliness and isolation, I think very superficially integrates family caregivers, and particularly caregivers of older adults or individuals living with serious medical illnesses and conditions. So there's a tremendous need to better integrate and center the unique needs of family caregivers as part of our national conversation on loneliness, and especially as part of our national efforts to promote mental health. Next slide. We also see important disparities with nearly a third of Latino caregivers reporting high levels of emotional stress, over 40% of Asian American caregivers, and a third of Black caregivers reporting high levels of emotional distress. And it's not surprising that when we look at this from a gender breakdown, over 50% of women report high emotional distress due to caregiving. And this mirrors the fact that caregivers women caregivers particularly shoulder the hardships of care disproportionately compared to men. Next slide. So as we think about elevating caregiver mental health and injecting the needs and perspectives of caregivers like Jeannie and Eve and Fei Lin, who you'll hear about in a little bit, is really key to being part of this national conversation, helping to catalyze and further this national conversation around mental health. That's why the National Alliance engaged in a multi-phase project to better understand the opportunities to promote mental health in the caregiver community. Next slide. Our goals were to, one, elevate mental health as a key caregiving issue. and vice versa. We're in this amazing moment where mental health is being talked about, being acted on at a national level, at the community level, raising the visibility of mental health disparities in different communities, which is really important, but we aren't always hearing and centering caregivers as part of that conversation, as we see in the CDC's loneliness report, for example. So really critical to elevate mental health as a caregiving issue. Also important for us to increase dialogue around the mental health of family caregivers, really looking at mental health as a primary outcome for caregiving interventions and policies, which is critical if we're going to start to promote mental health across the lifespan as part of the caregiving journey. And then third, really looking at what policy changes needed to support caregiver mental health. One of the, I think, important opportunities we have right now is that we're not just having a national conversation on mental health, we're also seeing a tremendous focus on promoting and advancing policies to address issues within mental health. And we have to see that same energy to integrate caregivers into that policy discussion. That's why we, next slide, entered into a multi-phase project that consisted of engaging subject matter experts, including Dr. Phelan Lewis, who you hear from in just a minute, family caregivers like Jeannie, academic research experts, industry research experts, to talk about what the landscape looks like for caregiver mental health. We conducted a robust literature review to look at interventions and policy issues that center caregivers in mental health. And we also talked to caregivers directly to understand the challenges that they're facing. And then we came together in May of 2023 to host an expert convening to share what we've learned and to start to elevate some solutions and policy ideas to address the challenges that we identified throughout the process. Next slide. And our key findings are broken out across 5 priority areas. One, really looking at the importance of and elevating the importance of behavioral health equity. It's clear from the data that I shared and from the review that we did and from the conversations that we engaged in that historically marginalized caregivers, Black, Latino caregivers, Asian American caregivers, LGBT caregivers, low-income caregivers, they're disproportionately impacted by the mental health crisis, suffering from a lack of investment and infrastructure around mental health, but also the lack of infrastructure investment in caregiving. And those things have come together to really put them at the crosshairs of our caregiver mental health crisis. Well, so when we look at family caregiver mental health research, we see that there are critical gaps in supporting research focused on improving the mental health of family caregivers. While there is tremendous research taking place, that's often looking at mental health as a secondary outcome and not looking at mental health and improving mental health as a primary focus of research. And so there's important opportunities to improve mental health research in the caregiving community. Also, when we think about mental health parity, even we see legislation requiring mental health parity, we see that there's still gaps and there's a critical need for policy intervention to address those gaps. And I think really something that came out over and over again in our discussions with both caregivers, but also experts was the workforce issue. The importance of investing in the mental health workforce, investing in the workforce more broadly, the healthcare workforce, to better integrate family caregivers and screen them for mental health supports and issues. As we heard from Jeannie, there's often a lack of conversation between providers and caregivers about the mental health situation that they're in and about the mental health needs that folks might have and the resources available to support caregiving, but particularly challenges with caregiving like isolation, anxiety, emotional distress. And so there's a tremendous opportunity to invest in providers, to incentivize providers, to improve the workforce pipeline related to supporting the mental health of family caregivers. And then last, as part of our multi-phase project, really what came out loud and clear was the importance of looking at and addressing caregiver health holistically. Really looking at whole health system approaches to supporting family caregivers. We're looking not just at their health issues, but also their mental health issues, their financial issues, and how all of these things are interconnected, and really the importance of elevating that whole person-based approach in order to address the root causes of some of the mental health challenges that we're seeing manifest along the caregiver journey. So we are excited about outlining this framework that touches on a lot of different pain points that caregivers face when it comes to navigating their care responsibilities, but also elevating and identifying some policy opportunities to help address these key findings and build on these key findings. Next slide. When it comes to family caregiver mental health research, one, it's important that we continue to invest in research with a particular focus on the mental health needs of family caregivers, and particularly those historically marginalized caregivers, really looking at how we integrate and prioritize their needs through research. But then also we see an important opportunity and need to better coordinate research focused on mental health across all areas, really kind of adopting that whole person approach and really looking at caregiving as intersecting across all different condition areas, mental health being an important area, by establishing an Office of Caregiver Health, Caregiver Research within the NIH, to help coordinate research opportunities centering family caregivers across institutes. We feel like this would be a good way to incentivize, to better coordinate and disseminate research opportunities centering family caregivers, including mental health research. Next slide. We also see mental health parity as being a critical issue. And so we recommend expanding mental health parity protections, which exists and have been getting a lot of additional attention, expanding those protections in Medicare Advantage, Part D, and to all Medicaid recipients. This particularly builds on the fact that so many of caregivers who are in the crosshairs of this mental health crisis are within these programs, and there are lots of parity gaps that limit access to mental health services. So really looking at holistically how we expand mental health parity protections by prioritizing these historically marginalized groups, but then also taking advantage of some of the innovative things that are happening within the Medicare Advantage program to address caregiver mental health. So I think there's lots of opportunity here. Next slide. And then when it comes to provider readiness and workforce development, we think it's really critical to reimburse healthcare providers at levels that incentivize them to identify and support the mental health needs of family caregivers. We're seeing some movement here. In fact, just in the past couple months, CMS released its physician fee schedule, which proposed 2 new CPT codes to reimburse healthcare providers to train family caregivers in executing a treatment plan on behalf of their care partner. One of the exciting things about that is, one, it recognized that caregivers are integral members of care teams. 2, it recognized that there are trainings out there that can help caregivers better take on their care responsibilities. And 3, in terms of the providers that would be covered, it included therapists and mental health professionals. So we're starting to see a greater focus. We need to continue to seize on that opportunity to create incentives to integrate the caregiver into care teams, but then also to incentivize and put an infrastructure for screening caregivers for different needs, including mental health supports. Next slide. When it comes to adopting whole health system approaches, this is something that we've seen done within the VA. So there's an opportunity to look at how HRSA and other government agencies can start to scale whole health system approaches to help address the mental health of family caregivers, really looking holistically and developing services and wraparound services that can promote both health, financial security, and mental health of family caregivers. Next slide. And next, I want to introduce our next speaker who can continue to help us understand the impacts that caregiving have on individuals from a mental health perspective, but also share her story and help to bring to light communities that are often under-recognized in our conversations around not just mental health, but also caregiving, particularly young caregivers. So I'm excited to introduce Dr. Phelan Lewis, the Assistant Dean for Student Affairs at Vanderbilt School of Nursing and a globally recognized researcher and caregiving advocate. She grew up as a young caregiver for her disabled mother, and her experience led her to want to change the world for other children while caring for family members. She is an established international researcher with expertise in young caregivers, young carers, and mental health. She's someone that we've benefited from her expertise, from her wisdom, from her lived experience as a NAC alum and also advisor to this project. I'm very excited to introduce Dr. Lewis. So over to you, Dr. Lewis.
Thank you, Jason. It's a real pleasure and honor to be here. And thank you, Jeannie, and thank you, Eve, for the lived experience and personal stories that you shared. It's truly an honor to be here on the panel with you all. As Jason mentioned, the cat is a little bit out of the bag. I also have lived experience as a youth caregiver. So not just as a researcher and as an advocate, but I actually grew up caring for my mother. Next slide. So at the age of 11, my mother was diagnosed with degenerative disc disease, and she was an ordinarily healthy woman. She was working as a registered nurse and running full marathons in Alaska. But with that diagnosis, she was scheduled to undergo a routine surgery for that condition. But unfortunately, that surgery was performed incorrectly, and she woke up from that surgery unable to walk. In one moment, our lives were completely changed. And myself at age 11, and then my older brother, Farrell, who you can see there in the picture on the left, we were thrust into youth caregiving roles. So me at age 11 and him at age 19. He dropped out of college, came home, got a full-time job, and started caregiving as a young adult. That meant paying our mortgage, our household bills, taking me to school. And I also was a caregiver for our mother. For me, that meant assisting her with intimate care like bathing, showering, helping her get dressed, and also wound care and giving her medicines at that very, very young age. Me and my brother did not have any outside help, no social workers, no home health aides, no nurses. It was simply me and my brother. I, of course, would not be in this position that I am today if it wasn't for the sacrifices that my brother made for our family. That picture there on the right is more of a recent picture. He went back about a decade ago to finish his degree, and I am so incredibly proud of the sacrifices and the tenacity that my brother really has demonstrated across his family caregiving journey. But what is important for me, particularly as I think about his legacy, is that that shouldn't have happened. I feel that with the 5.4 million youth caregivers in the United States here, that we really are in a position in the US where those youth caregivers are unsupported and unrecognized. Thinking of the theme in terms of our discussion today with mental health, across my journey, I certainly was isolated, alone, and certainly had thoughts of anxiety, depression, and even at times self-harm because of the intense burden and strain that we experienced as youth caregivers. And I know if my brother was here, he would say much of the same. So that is why today, next slide, that we want to talk about the impacts of not just older adult caregivers, but also children and young adults and millennials as well. When we think about mental health impacts, it is true that this runs the gamut for all caregivers across the lifespan. Depression, anxiety, PTSD, chronic fear and worry about the care recipient, worry about financial responsibilities. With children in particular and young people, we also see that they experience feelings of guilt and hopelessness. Those feelings of guilt are usually associated with thinking about that transition from childhood to adolescence to adulthood, whether or not they'd be able to move away from the family home, whether or not they'd be able to go off to college and university. That tends to be when we see the children become overwhelmed with that sense of guilt as they start to try to juggle being a family caregiver, a youth caregiver, and also that pull to want to experience life for themselves. What's perhaps most alarming to me as a researcher is that the research that I found with adolescent youth caregivers, so the ages of 15 to 17 years old, is that they were experiencing suicidal ideations and self-harming behaviors, such to the extent that they reported 56% of those young people in our study. Even more alarming is that we even had our adolescent youth caregivers report to us that they were having thoughts of harm to the care recipient, so the person that they care for. I want to highlight those figures, not to be sensational, but rather to call us to attention. Hello, can you see me? Can you still see our slides?
Yes.
Perfect. Okay, it's gone white on my end, but you can still see.
We can.
Perfect. Okay, great. Must just be a tech issue on my end. I'm happy to continue. So, and for us, we don't want to sensationalize this at all, but instead, it's more for us to, as practitioners, as advocates, as researchers, we really have a duty to recognize that these children, these young people, as caregivers, need support. They are under such strain and emotional distress that they are feeling thoughts of harm to themselves and in smaller numbers to the person that they care for. And with that knowledge, we truly do have a duty to make sure that we support those youth caregivers, and of course, caregivers across the lifespan. Next slide. So what do youth caregivers want? In the research that I do, they often say that they want recognition. They want to be seen as valuable members of the care team, recognized for their contributions that they are making to their family and truly to society at large. They also say that they want money, direct money payments to their family. And finally, they want guidance as they navigate through adolescence and young adulthood, and also someone trusted to talk to you. I know, of course, caregivers of all ages can relate to that. As Jason mentioned, these caregivers are often isolated, lonely, and of course, may in reality be very much alone in the caregiving duties that they have. So it's very important that we join together all of these various systems, whether it's policy, research, the nonprofit sphere, all of that to work together to support children, young adults, and of course, older caregivers. Next slide. So how can you, wherever you are, support youth caregivers and their mental health? First, I suggest that you listen. Listen to their stories. I know when I was having a particularly difficult time when I was a senior in college, and I had a professor who just pulled me aside after class. And she said one thing. She said, "Phelan, you are not yourself. What's going on?" And that one question was truly what I needed, that intervention, that moment. She knew nothing about youth caregiving. She didn't know anything about my family and what we were all going through. But her just sense of care and that patience and that advocacy to stop and ask, tell me more about what's going on if you're not yourself. That recognition was really what I needed to get into formal support services, to get connected to a counselor, to a therapist, so that I could offload the very many numerous difficulties that were going on in her family, whether it was me trying to study as I was in the hospital room with my mother, or the very real feelings of anxiety and depression that I was experiencing as a youth caregiver. So listen, that's something that we can all do. Recognize and identify. So now that you know a little bit about the experiences of youth caregivers, and again, caregivers across all ages, we now have that duty to recognize and identify, and then take action and intervene. Wherever your sphere of influence is, we do certainly now have a role and a duty, a responsibility to make sure that we are uplifting the voices of the most marginalized in our country, our family caregivers. Next slide. So what can you do? You can connect caregivers, again, across all ages to mental health professionals, even if we are not yet to the point where youth caregivers is a part of our national discourse. We're working on it. We're not quite there yet. But even still, that mental health support is invaluable, and it certainly was invaluable to me as a youth caregiver. Make sure that caregivers are having their mental health screenings and physical health screenings where you can ask questions about self-harm, those questions that might be more difficult for family caregivers to be vulnerable. Ask children directly about your home life. That's something that I've learned with my international research with youth caregivers, is that to truly get a capture, an accurate capture of their experiences, you must ask children directly about their home life and the contributions that they're making through family caregiving. We also have a duty, just as we're doing today, to educate fellow professionals and practitioners. So take the knowledge that you're learning here from this webinar and continue to spread it around where you work. Recognize caregivers, and particularly youth caregivers, as an essential part of the care team. And then finally, ensure that your staff is trained and engages in trauma-informed practices, as we recognize when we think about those significant mental health impacts experienced by family caregivers, that PTSD is certainly one of them. Next slide. I always like to say, in terms of the most thing we can do, is support the ill and disabled person. We like to think, particularly from a research perspective, that once you have the policy, the research, all that in place to support the ill or disabled person, then that should lessen the strain then that's experienced by the family caregiver, and certainly by the children and the young adults in the home. Next slide. The organizations that can help. Definitely NAC, we're in the right place for more information and resources, but also I want to highlight the American Association of Caregiving Youth. They are our premier dedicated national organization to support children with caregiving roles. CASM, they do phenomenal summer camps of children who are affected by parental cancer. The Elizabeth Dole Foundation and their Hidden Helpers Coalition, supporting children and young adults who are in families with military and veterans. The Rosalind Carter Institute for Caregivers, I know they're doing fantastic work with student caregivers, so young adult caregivers. The Family Caregiver Alliance, and Caregiving Across Generations. So I name all of those just to be, again, a reminder that we each have a part. Really, we all have a responsibility and a duty to support the mental health experiences of not just caregivers across all lifespans, but of course, those particularly very vulnerable children and young adults. Thank you so much. I'll turn it over back to Jason. Thank you.
Wonderful. Thank you so much, Dr. Lewis, for helping us to raise the visibility of those within the caregiver community that are often overshadowed and go unseen, particularly young caregivers. And I think the message that you left us with is one that resonates and applies to what we're trying to accomplish here, is that issue of that message of recognizing and asking. That's something that we certainly want to see more of. And in order to promote mental health, we have to have those conversations between the health system and family caregivers, asking that question, making that an expectation that that question will be asked, that there's that recognition that family caregivers are essential to the success of care partners, and that in and of themselves, we need to think about the outcomes and experiences of family caregivers, and that includes mental health. So thank you so much for sharing those words of wisdoms and that lived experience with us. And with that, we'll open it up for questions. I see that there are some questions in the chat, so I will start with one, and then I see my colleagues are joining me, so feel free to jump in as well. Veva asks, could this possibly be a question, concern primary care specialists ask at patient caregiver annual wellness visits? If they currently are a caregiver, if yes, provide resources, tools for their mental and physical wellness. Yes, absolutely, right? Like that is what we'd like to see happen. We just don't always see that happening. And part of the reason is there are very few incentives in place to incentivize providers to ask and engage family caregivers, but there's also a under recognition of family caregivers of the benefit of engaging the family caregiver and asking about their needs and about how we can better empower them to do their job better, whether that's providing support, moving a loved one from a bed to a chair, or whether that's something more complex like changing a feeding tube. All of that is skilled and requires training. And so we need to incentivize those conversations. And we also need to incentivize screening of caregivers around needs like mental health. But then also that coverage needs to be there, which came out in our conversation and our work as part of this mental health project. I don't know if Dr. Lewis, you want to add anything about that work stream of the provider engaging with the caregiver.
Right. I would just concur. Absolutely. That's when we talk about having those mental health and physical health screenings. I've been really privileged in the research that I've had in Europe to see that actually a question when patients are discharged from the hospital is, who are you going home with? And particularly, are you going home to a child under the age of 18? And that's being used in hospitals to help identify if there be then a youth caregiver in the home. So I think those type of questions would be essential, really, not just, of course, for my particular research interest of youth caregivers, but even caregivers across all ages, really. Who is at the home? Who will have that responsibility once you are released from a hospital? So yeah, that's fantastic. Thanks.
Wonderful. Let's see. And I thought it was interesting, Gina, you mentioned that even if you had been asked by a provider that you're not sure what you would have said. I'd love for you to tell us a little bit more about that experience.
Yeah, I mean, I think that when you're in the heat of the moment and you're bedside and you're there for that person, you're really not. I was not thinking about myself at all at the time. It wasn't until much later, and I mean years later, that I really realized the impact that it all had on me. I also would say I don't know that I would have, if my daughter was awake at that point. I don't know that I would have admitted in front of her. I would never want her as the patient, as the one I'm caring for, to feel that she's responsible for me needing mental health. So I think that's also something, maybe to be considered, because it's difficult. Like, I wouldn't want her to feel bad for me.
Yeah, that's a great point, and a reminder about the importance of not just asking once, right? We have to look at what are all the points across a care journey that we need to incentivize those conversations and finding the right time. And we're never going to find that right time if we're never asking, and if we're at the minimum, we're only asking one time. So appreciate that perspective. See a question around two-part question. One, I think Dr. Lewis, has there been any recent studies on adolescents caregivers since 2005?
So not on a national scale, so not on that level yet. And that's, of course, the work that we have to do here in the US. But what you will find are smaller scale studies, whether that's a survey research or whether that's qualitative research, doing interviews with adolescents and young adults. So those do exist. Much of that research, I would say, reflects the themes that we talked about today, that they're experiencing higher rates of anxiety, depression, chronic worry, lowered academic performance, absences, tardiness at school. But only more recently, with the research that I've been doing with my team, are we starting to get more reports of things like self-harm and suicidal ideations. And I truly think that's simply because we're starting to ask those questions of children and adolescents. But again, much more that we need to do on a national scale. But again, I think most of those, the studies have been done. It's more on a smaller scale, but more work for us to do here.
Yeah, absolutely. And I think there was an interesting follow-up question asking about differences in rural and urban caregivers. And we certainly see some striking differences between those populations. One, we see more difficulty in coordinating care for rural caregivers than we see in urban caregivers. We also see issues related to high intensity care situations. So there certainly are. I think that is like with youth caregiving. One of our goals as an organization is to elevate the need for more focus, research, engagement with certain communities of caregivers. And I think rural caregivers is right on the top of that list, along with young caregivers. And then most importantly, I think where identities intersect, right? Where, I think about the rural caregiver of color who's maybe trans or gay, like what is their experience and how are we building a system that's going to support them and therefore better support everyone along the way. So thanks for that question. Really interesting question from Morgan. How do we best get mental health resources to persons who do not believe they are a caregiver? They simply believe it is a part of life. I know how to word assessment questions differently, but getting mental health resources to them might offend them. Would love thoughts on that. Maybe Dr. Lewis, and then I think this touches on your actual experience with Jeannie about, having those conversations.
Great. Thank you, Morgan. That's an insightful question, and you're spot on. Identification with caregivers is something that we see in research. Personally, as an advocate and as someone who has lived experience as a youth caregiver, I would say that I try not to focus so much on the language. The language, the title, the youth caregiver or caregiver, that's so useful for lobbying, for advocacy, for having the organization, for the push for the work that we do. But I also make sure in the research that I do that I'm guided by what the child, the young adult, the caregiver, the participant in the research terms, what they want. And many times they simply see themselves as the child, the daughter, the grandchild, the sibling, and I recognize that. So when I do research interviews, I try to make sure that I mirror and reflect their preferred language. And I think that's really important so that we preserve and respect the dignity that they have. And usually they do identify more with their familiar role. But also, though, as an advocate, I see the usefulness and having that language, that title, that term of caregiver or youth caregiver. And so I believe there is usefulness with that. In terms of reaching out to persons with mental health resources, I would say, though, that you can try to, even if you don't want to use that label of caregiver, if you have someone in your family who's ill or disabled or has XYZ condition, that tends to be the language that I lead with researchers, simply because if you don't identify with caregiver, you may not see yourself and may not even open up that resource, may not even click into that link. So if you keep the language as broad and as inclusive as possible, that then I think can be the gateway to make sure that it's accessible for those who don't identify with that label.
Yeah, I think that's I totally agree. And I think really thinking about, how are we talking about issues that caregivers are going to be familiar with. So are you feeling anxious? Are you feeling stress about the role that you're in? Is sort of using other terms that might be less stigmatized. And let's talk about your mental health, for example. So I think, Jeannie, you pointed out, you're in this on a moment to moment, hour to hour, this is what I'm focused on today. So really looking at how you're dealing with that, I think could be one way to shift that conversation and to start to destigmatize that issue. And I also think that's where that whole holistic based health approach comes in, where we're thinking about this more holistically and not just thinking about it from the one perspective, but really thinking about having a more comprehensive conversation about someone's well-being can also help us to destigmatize issues related to mental health and having these conversations. Let's see, there's lots of questions, so I'm going to take a minute to look at one. It's similar to the flight attendant telling us that we need to put the mask on ourselves first before we begin to help others. And I think that's just another way of saying you can't pour out an empty cup, right? So Jeannie, your experience there certainly rings true. I'm wondering, Jeannie, how did you, what did you do to fill up your cup, right? When you were able to take that time for yourself?
Yeah, it came after, quite a bit of time, but it really started very slowly, and probably not with me really intently doing something. I started to get back to the gym and working out and doing those types of things. I started meditating, just trying to center myself. I realized that I really could have benefited from, formal, meeting with someone formally. Unfortunately, I didn't, have the funds to do that, my insurance, and I was dealing with other financial things that were more important at that point in my mind. But, had I, looking back, I wish I had done things differently. I think I would have come out of this a lot stronger had I really known more and taken different steps.
Yeah, no, thank you. I think you highlight some of the issues that we identified in terms of coverage and how having, eliminating some of those financial and access barriers changes the conversation and ability to act on the need for mental health supports and navigation. So that is something certainly that we'll continue to work on. Interesting question from Annalise. As a fellow advocate and family caregiver to my aging father with severe depression and progressive heart disease, I have come into contact with the challenges of navigating our current health system to support my father. The research presented shows the need for a whole health system approach and speaks volumes to the environmental disparity, especially related to access to financial compensation for the role of a caregiver. Any insight or new initiatives that can support our caregiver population as we support our loved ones. Addressing some of those key needs of caregivers can help impact the mental health crisis of our caregiver population. I think I totally agree with that, right? So we're looking at that whole system, whole person-based approach, that if you are worried about losing your job or not being able to put food on the table, that impacts your ability to care, that impacts your mental health, certainly. So what are ways that we can really link health, wealth, and equity in supporting family caregivers and mental health parity? I think there's some progress being made. One of the silver linings of the pandemic is it showed us that, and showed state policymakers, that there is a tremendous need to better invest in family caregivers. And so we saw 39 states expand programs to directly compensate family caregivers as they take on roles, formal care roles in lieu of direct care workers. So as a response to the shortage of direct care workers, we saw more states introduce pathways to reimburse family caregivers to provide and step in for those roles. However, of those 39 states, only 20 are sustaining those programs beyond the end of the public health emergency. So there's a model that exists that says, hey, we can do this. We recognize the importance of investing in caregivers. We know that caregivers want that, as Phelan's data underscored from a young caregiver perspective. We see that in our data when we ask caregivers across the board, what policies do you want to see? Over 40% say they want some form of direct remuneration because that would help with issues like mental health and maintaining economic security. So those policies do exist. It's fragmented, right? It depends on the state that you're in. There's a lot of barriers to accessing those policies, but there are also resources to help you navigate those barriers. There's a great resource out there called ADALY that helps you navigate what benefits are available to you as a family caregiver in your state and in your city. So it helps to kind of serve as a one-stop shop for identifying benefits, particularly government and state benefits that you qualify for. So highly recommend checking out that tool. Anyone else want to jump in on that? Well, I wish we had more time because these questions are fantastic and really underscore the need to continue to have this dialogue and, more importantly, act on what we've learned today in raising the visibility of the mental health challenges that family caregivers face along their care journeys, to better support family caregivers in providing care and serving in their essential roles, and integrating caregiving and all types of caregivers, particularly young caregivers, historically marginalized caregivers, women caregivers, into our national conversation around mental health. So we look forward to continuing beat that drum in partnership with the folks on this call, this Zoom, but also hopefully with all of you now that we have this report and recommendations out. So thank you again to our supporters at Travere, and a special thank you to Jeannie for sharing your lived experience, and to Dr. Lewis for sharing your expertise with us. And thank you all for spending the afternoon as we share more about this report. Here's the link. You can go to caregiving.org and access the report. We encourage you to share it and reach out to us if we can be partners in helping to bring this report to life. So thank you so much for your time this afternoon.